purpose of this study was to demonstrate whether pharmacogenetics is a tool that can be used to deal with a growing problem in this country, and that's the overuse of prescription drugs. According to the CDC in 2014, we spent over $300 billion on prescription drugs. And if you look at data from the FDA from around the same time, we also spent $140 billion treating adverse drug events. So if you do the math, for every dollar we spent on a prescription drug, we spend an additional 50 cents to treat the adverse events caused by those same drugs. So you can see it's a very costly and inefficient model. So we decided to look at 132 patients. We analyzed a number of genetic variants associated with pharmacogenetics and pharmacodynamics. And we took this information in conjunction with the expertise of a licensed PharmD, and we looked for opportunities to reduce or consolidate their drug regimens. And what we found was that in about half of these individuals, we were able to eliminate or replace anywhere from 1 to 3 drugs. And we wanted to quantify the impact of these changes, so we took the average wholesale price, which is published by the Centers for Medicare and Medicaid Services, and we calculated an annual savings of over $80,000 for this group. That amounts to about $620 per patient per year. So you can see that even after 2 years, we would start to recognize cost benefits associated with this approach. So to summarize, the use of prescription drugs in this country is enormous. The CDC predicts this will continue to grow at a rate of about 6.3% per year. We now have pharmacogenetic tools that gives us better insight into our patients and provides a roadmap that we can use to treat them in a personalized fashion. Now, additional studies are needed, and we plan to demonstrate the sustainability of these pharmaceutical recommendations. But others have already published studies that show decreasing prescription drug use results in decreased adverse events, decreased hospitalizations and clinic visits, and it improves activities of daily living and overall patient satisfaction. So we feel it's time to start rethinking on how we prescribe medications. We need to start moving away from this one-size-fits-all approach, and we need to start embracing these genetic advances. This is important not only in treating our patients, but for our healthcare system as a whole.